Good day, I am Jamie Cristobal and I will be preparing the operation site. The purposes of this procedure are to reduce the transient and resident microbial counts at the surgical site immediately prior to making a surgical incision. Next is to minimize the rebound microbial growth during intraoperative and postoperative period. Next is to reduce the risk of post-surgical site infection. And lastly is to prevent injury to the patient during surgical skin preparation. The equipment and materials we're going to use are bath blanket, moisture-proof drape, warm water, basin for solution, sterile gloves or we can use disposable gloves, skin set preparation or supplies, disposable gloves, sponges, and cotton tip applicator. For the goal is the sterile field is created without contamination, the sterile supplies are not contaminated, and the patient remains free of potential infection-causing microorganism. For the assessment, we're going to identify the presence of growth, moles, rashes, pustules, irritations, exudates, bruises, or brokens, or ischemic areas. So we're going to identify it first. So upon examination or assessment, there are no presence of any growth, moles, or rashes. If identified, we can provide the patient extra precautions when preparing the patient. For the planning, prepare all the materials and equipments needed. For the implementation, first we're going to wash our hands, or we can perform hand hygiene. Next is to identify the patient and explain the procedure to the patient. Good day, I am Jamie, your nurse for today. May I know your name? Thank you, Ms. Cristobal. I'm going to prepare you for your surgical procedure, which is the cesarean section. After that, we're going to drape the patient appropriately using the bath blanket. Next is we're going to don disposable or sterile gloves. After that, we're going to place the moisture-proof drape under the area to be prepared. Next is we're going to lather the skin using soap solution. Since this is a cesarean section, we're going to lather starting from under the breast up to the perineum or the perineal area. So we're going to use a circular motion, and we can lather starting from the umbilicus up to the area to be performed. Next, we're going to stretch the skin, stretch the skin taut, and we're going to hold the razor about 45-degree angle. So we're going to shave the hair in the direction where it grows, or we can do it downward since it is from the abdomen up to the perineum area. After shaving, we're going to wipe off the excess hair into the skin using sponges. We're going to wipe one stroke for each side. And then after that, we're going to clean and disinfect the surgical area according to hospital policy, usually using a betadine. And then next, we're going to inspect the skin after hair removal, and we're going to check for redness or any presence of brokenness. So upon observing there are no redness or any brokenness in the abdomen or on the skin area. And next is we're going to dispose of the equipment or supplies appropriately. So after preparing the patient, we're going to put him in comfortable position, and we're going to remove the materials and equipment used. For the evaluation, document all the relevant information, record the procedure done, the area prepared, and the status of the skin. That's it. Thank you very much.